Hi, and welcome back to another episode of PainFreeFinally.com. I'm your host, Greg Roulette, here with Houston's senior specialist, Dr. John Trowbridge. And in this episode, in this video, we're talking about the jaw. What I'm using to talk right now, and what we're going to use in a couple minutes to have some lunch. We use
That's right.
so much, but there's a lot of people going around with a lot of pain.
Yeah, and unfortunately, most of that is poorly treated because a lot of the doctors involved, including the dentist, don't really understand the mechanism that is at play. Okay?
Yeah.
And actually, that's where a lot of jaws get injured at play. You know, you're kind of messing around, you get a little bonk here,
Yeah.
or you fall into something, whatever. And even in whiplash injuries, you can create jaw injuries thanks to the mechanisms of the muscles involved and so on. And you know, we don't really think of jaws terribly much except moving them up and down, okay?
Yeah.
Except there's a little hinge problem here, right there, and that's called the TMJ, okay? Now, that little joint has a little tiny, it's like a little washer in it, okay?
Yeah.
That allows it to slide and glide easily, unless it doesn't. And when it doesn't, that's very painful. So people can't open their jaw or can't fully close their jaw.
Yeah.
And you start changing your eating patterns. You start saying, I can't really chew that. I can't do this. And once you change your eating pattern, you can dramatically change your overall health pattern.
Of course.
Because we were designed to chew the food that we're taking in.
Right.
And the other problem is that people get stuck with headaches, neck pains, all sorts of discomforts that they have trouble describing.
Yeah.
And cortisone is not the treatment. Pain pills is not the treatment. Surgery can be, but it's often not. It can be fairly dramatic to operate on the jaw where they actually take out or sometimes even try to replace that little washer in there.
Wow.
Okay. This is complicated stuff. And remember, you're the one that goes home with the result.
Exactly.
If it's great, you're happy.
Yeah.
And if it's not, you don't. Well, the neat thing about treating something like this is all the other things that can get better. You can treat the jaw joint so people can open it up. Now they can actually eat their food. Now they don't have the kind of headaches. You know, you don't realize it, but all the muscles involved in moving your jaw are right up here around your skull.
Yeah.
And those reflect to the muscles back in your neck. And that's why with a whiplash injury, you stress these muscles and those muscles and these muscles and can actually create a jaw joint problem you didn't have before. Misalignment on your teeth can do it. How about when they take out teeth and it doesn't quite ever align correctly?
Yeah.
How about when they put in a filling or a crown and it's slightly high and it bounces and it's uncomfortable? And problems like that can end up creating an arthritis, a joint problem. People don't realize. Now, getting it fixed is critical because drugs won't do it. Maybe surgery or more surgery might, but not as likely as doing stem cells.
Yeah, well, and again, those options don't sound very appealing,
They don't sound
right?
good, do
Again,
they?
if you're coming in here for surgery, I mean, that's not, you know, I'd rather they didn't. you
Right.
know?
Well, you know, people don't know really exactly how to complain. They'll say, my ear hurts. Well, it's true because the joint is right there next to the ear.
Yeah.
And you can end up with all sorts of misdiagnosis until someone finally really figures it out. You know, even sleeping at night can be uncomfortable because you're trying to find position for your jaw, and there isn't a good position.
Yeah.
Or lying on it can be uncomfortable, so you have to sleep in different positions. So people don't realize it because it's such a tiny little zone with such a dramatic impact.
So now you did mention one way to treat it that you've seen some success with in your office is stem cells.
Stem cells.
Stem cells.
Awesome.
Let's talk about it.
It's just little tiny bits of stem cells because it's a little tiny joint, okay?
Yeah.
The neat thing is that you have these structures around joints, okay? Not just the rubber bands that attach the muscles, but actually the little washer that's in there to help with the motion and stuff like that. Well, when you have those structures impaired, they're injured, they're inflamed, because that's the signal to tell the body, I need some fixing over here.
Yeah.
And when we put the stem cells in, they're ready to fix right then. We use the unique stem cell product that is vibrant, enthusiastic, ready to go, put it right where it needs it, and it's remarkable that you can feel dramatically better because you're getting dramatically better. You're actually getting the healing.
Yeah, you're actually getting repaired.
Exactly.
Now, one of the big things that you mentioned that I want to talk about is someone watching this might not know that it's a jaw issue, right? They might be complaining, like you said, of headaches or earaches or different things.
Or dental mismatch, whatever, not realizing that the jaw is that important.
So how do we know that it's the jaw, right? You know, we don't know what we don't know, right?
you know, getting the proper diagnosis is sometimes frustrating because which specialist do you go to?
Yeah.
And my recommendation is you can start with our quizzes at the PainFreeFinally.com website, and then let me get more details from you, so that I can give you the best advice. There's no sense in traveling to get care from me if that's not going to be the right care.
Exactly.
And really diagnosing it is that important. That's the way you get it fixed right.
Yeah, I think that's really important, is the diagnosis. Taking the quiz at PainFreeFinally.com, because you know, someone maybe they saw an ear, nose, throat person, maybe they've seen their doctor, maybe they've seen a dentist, and they can't quite get it down.
Or their special headache doctor and all the drugs you can get for headaches.
Yeah.
Well, once you take away the reason, treat the cause, you don't have the problem.
Exactly. So as you're watching this right now, if you are experiencing some pain and it is jaw related, or you want to see if it's jaw related, and you want to treat it naturally with stem cell treatment, PainFreeFinally.com is where you need to go, and you need to go there right now. And you need to take this short quiz. It'll only take a few minutes of your time, but it'll get the doc the info that he needs to make sure that stem cell treatment is the right treatment for you, so that you can treat yourself naturally and you can wake up tomorrow and eat the foods that you want, have the conversations that you want, and smile the way that you were meant to smile, so you can wake up every day pain-free finally. Head on over to PainFreeFinally.com, take the quiz, and we'll see you in the next video.